just a little bit. So from my point of view, anytime you're dealing with healing, obviously the first thing that you always want to look at is what you call removing interferences. And that can be done then by, you can use chiropractic, where you have then the nerve flow that supports all the tissue and make sure that nutrients and energy, electricity, nerve conduction, neurotransmitters, all these different things reach then their targets. And you have within the spine, you have all these different vertebrae, and if they're misaligned, then that puts pressure on specific nerves that then reduces then that energy flow, so to say, to the specific target area. And what the symptoms you can feel are obviously pain is a common reason that you go to chiropractic, but also it can be any kind of dysfunction of an organ. So if you're dealing with ulcerative colitis, and if that nerve flow doesn't support the intestines properly, then you want to make sure that you correct that nerve flow, so you remove that interference that is that stops the transport of nutrients into the intestinal area. Then you can do that the same way in naturopathy. A patient comes in to me and they're dealing with health issues, and I'm looking to see what is it that is causing, what is the main cause. I'm not into masking symptoms by just taking a pill to get rid of the symptom. I want to find out what is the interference that is causing this to go wrong. So it can be anything. I mean, it can be some pathogen that they may be dealing with, like a virus, bacteria, fungus, parasite. So then you want to take a look and see what impact does that pathogen have. Or it can be then some chemical that's creating an inflammatory response, or it's interfering with the kidneys or liver or any type of organ where it's then making it harder for that organ to function the way that it should. Or maybe it is something that's causing an inflammatory response, like a food or something that you're allergic to, like dust or mold or anything of that nature. So as a naturopathic doctor, then you want to make sure that you use natural agents to kind of support the body to move these chemicals out or these heavy metals out, or you or ask the patient then to stop eating a food that they're sensitive to, so that you remove the interference pattern. And once you've done that, you then want to supply nutrition to that area, because the different target, let's say the kidneys were the ones that were having a tough time, and your joints are achy or you're swelling, you're not able to move toxins out of the body enough, and you have fluid retention. And because of that, then, and that is all because of the kidneys. And we find out that the kidney is having a tough time then with a certain chemical. So we want to make sure that we then support the removal of that chemical from the kidney, so that it can then start to function properly, and by filtering the blood properly, then it can remove the toxins that accumulated then in the joints that are causing then the sore joint, or that is causing the swelling in the feet and so forth. And then you want to supply then with the nutrition to the kidney, because then after you remove the interference, you want to feed it with proper nutrition. And that can be any kind of food like parsley, celery, nettle, corn silk, horsetail. There are a lot of different herbs and foods that are amazing at restoring kidney function, because it contains all these minerals and vitamins that are beneficial.